So my name is Maria Ferreira. I'll just be on hand to moderate and admit folks in. This year, you're right now in track 4 for a skill building workshop advancing health equity through human-centered design. It's my pleasure to introduce Kim Hunt, who is the Executive Director of Pride Action Tank, Senior Director of the AIDS Foundation of Chicago, and Dante Keys, who is a Digital Communications Manager also at the AIDS Foundation Chicago. So Dante and Kim, welcome. It's a pleasure to see you. Pleasure to see all of you. Take it away.
Absolutely. So can I start sharing my screen?
Yes,
Yep.
go ahead.
Okay, great.
I am recognizing some familiar faces. I see Bonita there. Hey, Bonita, former AFC employee.
Hi, Kim. Great to see you.
Hi, you too. There we go. Well, welcome everyone. So this is going to be a very interactive discussion, and what I want folks to do, it's Friday, let's have some fun. So take out a pencil and paper, and it doesn't matter what size it is. What we want you to do first, as we're getting warmed up, is to draw a picture of a cow. Whatever cow means to you. Does not have to be these lovely blinking cows on the screen, but your version of a cow. And we're going to come back to it later. And I want you to know ahead of time, you're not going to be judged on this, at least not by me. I cannot vouch for the other people who are part of this group. He said he's not going to judge you either, but just give it a try. You know, a lot of times we're in these spaces where we're writing a lot, so we like to give you the opportunity to draw, and we're going to come back to that later. So don't cheat, actually do it. Just draw whatever cow means to you. Okay, let's go to the next slide. All right, so welcome to the workshop, and keep drawing those cows. Before I get started, I would like to say that I personally am not an expert on human-centered design. For me, this has actually been really a journey of discovery as my team and I have built Pride Action Tank, which I'm going to talk about just a little bit later. I also want to note that many of you are already doing at least some of the steps associated with what we're calling human-centered design, or HCD. You may call them something else. You may not have a name for them at all, but some of this you're already doing in some form or fashion. So let's utilize the chat for just a moment and put down your pencils. And I just want to know who works for an organization or institution where innovation is sort of a key driver for the organization, or innovation is a topic of discussion. And I don't know, can we do the raised hands? If you know what, if you just show your hands on the reactions, put a thumbs up, we'll get a sense of that. So who talks about innovation or uses innovation tools? I'm seeing a few thumbs up. Very cool. Very cool. So a lot of times our organizations sort of work at the margins, tweaking projects that have been in place for years, sometimes wanting to break out of a box, but not always having the tools to do it in a strategic way. And that's okay. Sometimes also, let's keep it real, there's fear that funders won't be open to funding something new. But we want to today talk you through some processes for doing this in a strategic way. And human-centered design is one way of bringing innovation into the organization. It's practical, it's a repeatable approach to arrive at a feasible and equitable solution that meets human needs by putting the people at the center of your research, development, and implementation processes. Next slide. So a little bit more about me, and then I'll let Keith speak for himself. So again, I'm Kim Hunt. I'm both the executive director of Pride Action Tank, which is a project of AIDS Foundation Chicago, as well as the senior director of policy and advocacy operations at AIDS Foundation Chicago. I have been doing some type of work around social justice and equity for the last many years. Today, I don't necessarily want to say how many it is, but it's been a long time. I have a lot of gray hair to prove it. And have been privy to a lot of folks who have done social change work, have been involved in social change work myself, and have had the honor over the last few years to work with my co-presenter today, who has really helped me bring language to some of the things that we've been doing through Pride Action Tank, and I'll say bits and pieces throughout my work in the social justice space. And that is Dante's Key.
How can you follow up with the legendary Ms. Kim Hunt? I'm so glad to be here with Kim today and to share this framework that has really transformed my work in the last 4 years. I started looking at or started studying human-centered design in grad school, and after grad school really started utilizing that framework both as a teacher and as a facilitator to propel like really the needs and look at the needs around communities that I'm involved in, the communities that I care about. So I'm really excited to be here and I'm ready to jump in.
All right. Next slide, please. So let's talk a little bit about Pride Action Tank, otherwise known as PAT. PAT launched as a project under AFC, AIDS Foundation Chicago, 5 years ago. Actually, our anniversary was October 19th, so just a few weeks ago. And PAT is a project incubator and think tank that is focused on action. And that is action that leads to improved outcomes and opportunities, both for LGBTQ plus communities and individuals, but also for other marginalized groups throughout the Chicago region, and I'll say beyond, because we also get engaged with statewide work and a little bit of national work too. We're a multi-issue entity, and our issue areas of aging, financial security, health, housing, safety, and youth have been greatly influenced by a 2012 and then a 2019 update of the LGBTQ needs assessment conducted by the Morton Group in preparation for the LGBT Giving Council of Chicago Community Trust to think about, what are the areas they're going to focus on in their giving. So we've kind of taken that work and run with it in terms of creating space for collaboration, inquiry, advocacy, and action that brings some of the desires of both of the folks who were participating in that study to fruition, but also over these last 5 years, the different groups that we've worked with under these issue areas in various ways. And I'll back up and say a little bit more about our model. Typically, we have a 2-day summit focused on a particular issue area where we drill down pretty deep. And the 2 days are because we want to have a first day that is just for the folks who are impacted by that issue. So if the issue is LGBT aging, we want LGBT older adults that first day. The second day is for anyone who wants to return from the first day, as well as focus on service providers, researchers, policymakers, funders, other folks who are touched by the issue but aren't necessarily living it. And we structure those summits or gatherings to be very interactive and solutions driven. So in addition to your typical sort of keynote addresses and panel discussions, we also make a lot of space for facilitated conversations where we are dropping in a couple of questions for each subgroup to address that helps us get to some of the themes that we're hearing as important for the day or for the issue, as well as teasing out opportunities to move that work forward with projects that we incubate. And if they prove viable, the goal is to pass them on to another organization that it makes sense to pass it on to. And that way they've already have a project that has gone through sort of a research and development phase that they can then show to funders is viable and meaningful for the community that is the subject of that project or program. So we've been doing this for 5 years now. We're learning a lot. We're tweaking the model along the way, and human-centered design is a big part of what we do. Next slide, please. So just for you to know, for the next 60 minutes or so, we really want you to, and let me say, don't forget to draw those cows. We want you to get out of your head and get inspired by the people that you are actually creating for or working for. And we want to really tap into your ability to generate new ideas and reach better solutions by really tapping into the perspectives of the people who you serve. We also want you to overcome any uncertainty that you have through a process that is iterative and designed to spark creativity and gain alignment with the people that you serve. And then, turn those tensions between ideas into opportunities that really extend and offer addressing the emerging needs of the various identities that you're working for. Next slide, please.
Want me to take this one?
Yes, please.
Yeah, so like during this webinar, we want it to be really interactive. So it's really a welcome to, welcome you to mute yourself, if you would like to speak verbally. We like call and response, engage in the chat with us or members in the community. But then also we want you in the activities as we're talking about these different things to engage, listen, but to also share. Sharing is a real big part of this process. And apparently the CTA would like to share my sound bites with me. So excuse me if you hear the train going along, but that wasn't an aha that I found when moving here. But my first person experience related to that could tell you that it's very annoying. So as we move along, share that type of feedback, that real feedback, and really this is a learning experience for all of us. So yeah, please join in.
Before you advance the slide, I just want to remind folks that everything that you interact with, to Key's point right now about the train, was designed by a person or a group of people. And you are just as smart as all of those people. So this is stuff that you can do. All right. Is this you or me?
Oh, I can go ahead in it.
In there.
All right, yeah. So yeah, let's dig a little deeper. So and we're gonna come back to the cows a little later. I know people are waiting, when we gonna show our cows? I want to see
I
them.
hope you're drawing them. We do want you to draw them.
Listen, use the things around you, Post-it, pencil, use the things around you. But let's dig a little deeper, into human-centered design, right? So, when we're thinking about human-centered design, we're thinking about a process that centers those who are at the end of things that we're designing to meet their needs, their desires, but actually things that they deserve, things that they use, things that are useful to them. So, how we look at human-centered design, or how it's been introduced, is that it's introduced in this three-phase system, right? Or this three-phase process, and that's empathy, ideation, and implementation, right? So, with the mindset of defining solutions that meets the desires and the needs of the persons in our community, we want to make sure that these solutions are feasible, most definitely, that they're also viable, but offer things that people actually need. Move this a little along. So yeah, so human-centered design is really an approach to problem solving and designing and managing solutions that are not only desirable, as said, viable, but also feasible. Countless interventions and programs are emerging to address a series of needs before COVID, social determinants of health, and even amid and beyond COVID. And in thinking about those innovations, the parts of this process, as it describes in this video, seems really familiar, right? Looking at what does the community want, what can we do as an organization, but then also what we should do. Right. So in thinking about human-centered design and designing solutions and designing servant offerings that, really serve this, something that Kim actually, really shares is that it's important that we're having language that connects to the actual experiences. So, when thinking about desirability, it's like what people actually need, what they want, what they use. When we're thinking about viability, us as an organization, we can do it. We have the resources, we have the model, we know that we can do it. And we should do it often looks like funding, right? Do we have the resources or the backing to continue that sustainability around this solution or around this idea? Anything you want to add, Kim? No?
Yeah, I do want to add that, even though we talk about, feasibility in particular around this funding piece, and we talk about, the limitations of our organizations, I think it's also important to add a caveat that we have to dream. We have to keep dreaming as as folks who are focused on health equity and social justice. And a quote that I like to share comes from a book called Octavia's Brood. I'm a huge sci-fi fan, and my favorite author is Octavia Butler, who is unfortunately no longer with us, but Black woman who really paved a path in science fiction for women in general, but Black women in particular. And Octavia's Brood is an anthology of science fiction short stories written by, I see a lover of Octavia Butler there. Keep using that chat for that love, yes, and that interaction. So Octavia's Brood is an anthology of short stories written by social justice activists. And one of the authors of or not authors, but editors of the anthology says that because all organizing is science fiction, we are dreaming new worlds every time we think about the changes we want to make in the world. And that is the intent that I try to bring to this work. And I know many of us are part of the nonprofit industrial complex and academia, and sometimes we forget why we're there. It is about dreaming up a new world and making it happen. And I think human-centered design is just a wonderful way to bring that to fruition. So I wanted to share that even in the context of thinking about what's feasible for an organization to do, there's still space for us to dream. Now I'll let you move forward.
So yeah, so thinking about that dream and how do we move that dream forward? Human-centered design offer us this like process, and like most processes, we think very linear. But we want to emphasize that for this process and for this webinar, and as you move forward in utilizing human-centered design, is that we don't want you to think linear. We really want you to think this as a roadmap, as building blocks that can loop, that you can come back to at different modes to arrive at a solution, right? In human-centered design, and how I've learned it from one of my advisors, Natalie Nixon, is that it's like chaotic, right? Sometimes you have to come back because you didn't learn enough. You figured out your blind spots. Sometimes you need to ideate again because the solution doesn't meet the needs. So really, we want you to think about this as an opportunity to test, send out, repeat, ideate, do all of the things, right? But really where we start is that we start with empathy. You know, we really need to know how and what the persons in the communities that we serve actually need, and what does those solutions look like without them a part of the process to help inform them. So yeah, so consider this as a roadmap as we talk about and go through the tools later on, but let's jump in.
Okay, this is the moment of truth, y'all. So Keys, if you would stop sharing for just a moment.
Okay.
And let's turn on the gallery view, everyone, so we can see all your lovely faces. So what I want folks to do, turn on your cameras. And if your last name is in the A through L range, hold your cow up to your camera. Don't be shy. Nice, look at all those lovely cows. Wow, some of you are really amazing drawers. Let me scroll over, see who else. There you go. Wow, love the cows. Okay. And then for, what would that be? M through Z, hold up your cows. Wow. Love it, love it. Thank you, thank you. Okay, thank you for participating in that. I really appreciate it. As adults, a lot of times we don't want to draw anymore. And I am not a drawer. I'm not good, but occasionally you need to whip out a pen and piece of paper and just doodle, go to town. Okay, Keys, you can go back to the screen.
Okay. Let me go back. Okay. Ooh.
So any thoughts on why we ask folks to draw a cow? And you can type in the chat.
Oh, okay.
While Keys does that, goes back to our
original. I'm sorry.
It's
They get
okay.
They're getting all the goodies.
We don't see it yet.
Oh, you don't see it yet?
Yet.
Great.
So yeah, folks, share why do you think? Why do you think we asked you to draw a cow? Let's see. Everyone has their own individual style, maybe to get us out of our heads into the zone. Different people had different interpretations of cow, life experiences, show our different perspectives, different views. Some folks have no webcam, different skill sets, all great responses. In addition to that, the things that folks are offering, it's important that people have a beginner's mindset when they move into this work. I meditate every morning, and I really need to these days, but it's a practice that I started a few years ago. And in meditation, and I'm also a Buddhist, we also talk about beginner's mindset to really, get that junk out of your head that we all walk around with in every room we enter as we go from meeting to meeting. This is a super creative process. Folks need to be open. I say open your mind space and your heart space to do this kind of work. And so the silly cow is really just to get us out of our heads And we want you to know that no cows were harmed in the development of this workshop. So that is an exercise that I really encourage folks to do or do some form of. Maybe even at the beginning of every day, certainly in the beginning of moving into a creative process with other folks, because it's so helpful to get the other stuff out of your head before moving forward. All right, let's keep going. Yeah, the cows are almost hypnotizing, aren't they? So, next we're going to talk about empathy. Empathy is super, super important in this process, but also, you know, frankly, as activists and advocates, empathy is hugely important to our work. For human-centric solutions in particular, empathy in storytelling can really help facilitate this process. We know that as human beings, we're super social beings that have evolved by sharing information. And more often than not, we share information as stories. We use stories to define our experiences, our perspectives, and perceptions of the world around us. And as part of the work to advance and improve systems, for us in this case, in the care of youth, because that's one of the areas that we work in an area very much indeed of equity in the healthcare sector. We listened to the stories and experiences of young people in the examples that we're going to go through as we illustrate the tools with you. So we can go to the next slide. So I mentioned before, and if you'll hold on just a second, my wife is working in this space too. So we're going to do a little separation here because I forgot she had a meeting too. So ignore me for just a moment.
I can go ahead and pick up where Kim. So yeah, so this right here, as Kim stated that, oh, Kim's back.
Yeah, I just needed to close the door. So as I mentioned earlier, Pride Action Tank organizes these summits or convenings when we begin our work in a new focus area, and it's usually 2 consecutive days. So we, in November 2018, we did a little bit different with our Youth and Systems Summit. But it took place, the Youth Day took place in November of 2018. Keys, that was 2 years ago. Can you believe it? It came up on my timeline the other day. We're looking at the LGBTQ, the overrepresentation of LGBTQ youth in systems such as child welfare, juvenile justice, and also as I will say the victims of punitive school policies. And we created the summit with the help of young people to create a platform that centers the voices and experiences of LGBTQ plus young adults, to shed light on the issues they face and gaps in services, resources, and opportunities within systems of care. Another objective was to identify opportunities to build capacity for families and communities to support system-involved LGBTQ plus youth. And then thirdly, an objective was to develop an agenda for advocacy, resources, and inclusion with and for LGBTQ young adults and service providers. And by the way, they did that cow exercise that you just did. And I think what's really interesting is that they took it to a whole nother level. They drew pictures of ice cream and glasses of milk and hamburgers. I mean, it may speak to the disassociation that we have between where our food comes from and what we see in the grocery store. But I thought it was really cool that they thought outside of the box. They thought about what a cow means to them. So that was really cool. Next slide, please. So empathy mapping is a super important tool that I've just started bringing into just about everything that I do. It's foundational to human-centered design. You really should do what you can to truly understand the people who are experiencing the problems that you're trying to address before designing a solution to meet their needs. So when we use the term systems involved youth, it was, like I said, to describe youth involved in the juvenile justice system, child welfare, or both systems, because there is a lot of overlap, with specific emphasis on youth who are incarcerated in foster care, or youth exiting or having exited these systems. And within these systems of care, cultural and systemic biases about race, sex, sexuality, gender norms, and others are among the providers that influence attitudes and decisions and outcomes on a person's care experience. So these are things that providers are bringing into a space, those biases, when they're working with young people in this case. And to gain insight into the youth experiences with these systems, we used a tool like an empathy map. And this is a good way to do some visual thinking. It's often indispensable for some folks who are just not, the words are not all, right? It's really about moving these ideas around and getting a sense of where people's heads are, and getting inside people's heads. So we use Post-it notes to just sort of move ideas around under these various categories that you see here that we'll go into a little more. Yeah, you can go to, so needs, actions, influences. These are the things we were thinking about as we were thinking through the empathy map. Okay. You want to jump in here, Keith? You're on mute if you do.
So always so interesting because I talk a lot and you would think that I would know where the mute button is, but obviously I don't. But yeah, this is really an opportunity. I really love the empathy map. When learning about human-centered design, and there go the train again, taking my audio. Where's my background singers?
Keith, there's a question here that I think you're going to get to in the chat. And I think it was about the categories on the previous slide. The question is that standard, or does it change from map to map?
No, that is a great question. So the standard when thinking about mapping empathy is what do we need to know as it relates to the experience or the problem we're analyzing, or we're discovering, or we're unpacking. So typically how the empathy map was created and introduced to the community was that it's a map to think about what they like the five senses, what they think, feel, what's going through their head, what are their pains and gains, what are their thoughts. But with human-centered design, we want to design it around not only what our needs are as humans who are propelling these initiatives and doing this great work, just like many of you on this call, but then also what is needed for us to solve or create a solution for those persons or the communities that we're looking to serve. So I think needs, influences, barriers, and sometimes it's listed as gains, pains and gains are standard. We think about action, and how I think or how we was thinking about actions were, what are the actions that need to be taken in order for these youth who are within these systems of care to reach their optimal health. For me, as a person who works in digital, what is the action that I need them to take in order to, set up a series of ad sets, right? As we're talking about COVID and moving into the digital space. So you want to design the prompts around what do you need in order to make this solution viable and desirable for those that you serve, but then also successful as an initiative. Which moves right into, a great opportunity to do activity. Empathy mapping really, as when you're doing it as a team, helps align our understanding of a person or a community and what we know about them, and then also what we don't. So utilizing the map before, really want you guys to take 5 to 7 minutes and really think about the given community that we've been talking about, the given person. So we've been talking a lot about the experiences of youth, system-involved youth, and given what we've shared in both the slides, but then also in conversation, what do you know about them? What are some of their pains and gains as they go through and experience these systems of care as it relates to foster care, as it relates to juvenile justice? A lot of the work that I do, and we're going to, as we move into the other phases, to talk about more health-aligned discoveries, that always thinking about what is that experience, right? What is the problem that we need to solve? So in thinking about where we want you guys to focus, we want you guys to focus on them. Utilize this community, utilize these youth, these beautiful faces, and really think about their experience, right? We call them system involved youth for the sake of framing their experience for this workshop, but really their youth. I was a youth 6 months ago. 6 months ago, just turned 30, but I've experienced some of the same experiences that they have. So that intuitiveness of, going through the juvenile justice system, going through foster care was something I can easily relate to as a facilitator. But what I want you guys to do for the next activity is really utilize those prompts and what you know about them to really explore who they are and what you know about them with the empathy map. So I think we're going to go back right here. And I think I can switch my screen. How do we want to do this? How would be best?
If you can stop sharing, Dante's, and then go to the screen you want and reshare.
Okay, great.
And I don't hear the train. I don't know about everybody else. I don't hear it.
Trust me, you'll hear a fire truck if it comes out of this station across the street. So, but that's great that you can hear the train.
Yeah, so this is the, okay. I guess I'm the only one who hears the train.
That's fine. That's good.
Okay, can I share it like this? Yes. Does this work for folks?
We see the needs, actions, influences slide.
We see the same thing that you had before.
Yeah. So this is what they will utilize for the activity for the next couple of minutes. Is this slide? So would it help that the activity is up there? What would be most useful for folks?
I think the slide before.
Okay.
So they're just, addressing these questions, right?
Mm-hmm. So you want to think about the prompts as questions and frame them as questions. What are the needs of system-involved youth or youth who are involved in systems of foster care or child welfare? What are some of their barriers in actually achieving their resources and needs, optimal life once they age out? What are some of their goals, as experiencing in these systems, right? And with the system that we're thinking about is our foster care systems, our healthcare systems. We're also thinking about our justice systems, our community-based organizations. We want to think about that. And what are some of their influences, both good and bad? What are things that help them wake up in the morning? What are things that bring them down? So if you can take the next 3 minutes, to really think about that and come up with some prompts, we can discuss a little and then move it along.
I think you can put it back on the slideshow view.
Okay. I want to see because for some reason, Kim is actually advancing the old version and not the edited version.
Okay.
So
Okay, we'll leave it there.
we'll leave it there while I figure out what's going
Okay, I see the method to your madness.
on.
Dante, so I don't know if this helps, but if you go under slideshow, I think there's a manual setting so it doesn't get ahead of you. Because I know this has happened before to me.
Oh, when it plays the old version and not the version.
Oh, I thought you were saying it just is advancing the way that you don't want it to, but it could be.
Yeah, for some reason it had the older.
My timer is on, by the way, so we'll be able to give folks a. So don't look at the screen.
Okay. Give me 1 second. I'm gonna.
You can stop sharing.
Okay,
Then folks, we'll just go back to the gallery view while people work.
great. Okay, yeah, let me.
And I can type prompts in the chat. Here are the main ones. Oh, one more. Now I hear it.
Oh, now you hear it.
Yeah. It's only because you're not talking though.
And Kim, if you want me to put the actual, I can put the empathy map in the chat if that would help folks.
Sure.
Okay.
Then you can open it.
Yes. There you go. We're always here to help. Now, while I help myself, because I was like, that is not the slide. Okay. Okay.
Got just under 2 more minutes. No pressure. Okay, 1 minute to go.
Okay. I feel better. It was the S. And I was like, oh, it's doing it again. Just like this process, things take many iterations,
There you go.
folks.
There you go.
So
Okay.
we want to make sure that you guys get the right iteration for today.
Okay. All right. We're wrapping up. All right. Time.
Okay. So I'm going to go ahead and okay. I just wanted to come back to this slide because we didn't have it before, but indeed, this is one of my, favorite quotes that was made in both the summit as well as one of the leaders in the framework of human-centered design, IDEO. But I want to say one of the facilitators of the day, they said, there's no room for predetermined or prescribed solutions. How we employ empathy is critical, if not more, as we do in a process. So, but I really love that, like, one of you, they were like, oh no, we don't got no time for that, So the energy and the language, it's really an opportunity to listen and learn, right? We say, once again, systems involve youth, but to them, I'm just a youth who is in foster care. I'm just the youth who has to go to the justice system, So those are definitely things to consider. And then now I'm about to go to the right slide. Okay. So yeah, here, do we want to share insights out?
Yeah, let's ask for a few volunteers. And as you're preparing, I'll just explain what this slide is about. So this is a picture of the young people we worked with participating in their think tank. And it started with empathy. And I'll be honest, they were skeptical about this exercise at first, but in no time, they totally jumped in, all hands on deck, and really, really got involved. And it was amazing to watch them think about who they are developing their solutions for. And this is a photo of them preparing to report back, and the enthusiasm around doing this was just amazing. So let's take a minute or two for one or two folks to just report back on how you responded to these prompts. And if folks just want to turn their mic on and go for it, because I know folks tend to be very shy. So go ahead and jump in there if you're one of those bold people who wants to share. Or I can call on someone.
All right, I'll go. So I was thinking that one of the needs would be a vision for the future, like in a pathway of how to get there. Another need would be some sort of outlet for the passion and the visions that they have. Also, connections to others would be really strong needs.
Mm-hmm. And did you get to any of the other prompts, Benita?
Yeah, so some of the goals would be a vibrant, healthy life, sustainable future, a way of supporting themselves in a sustainable way. A goal would be affordable housing or just housing in general. Also, jobs, meaningful work, and also a goal of like really healthy connections with other people, like healthy connections to community. Also mentors, of having like these like broad mentors in their lives.
Thank you for being that brave one to step out there, Benita. I really appreciate it. And,
Sure.
and I'll just say, just as an individual, taking the time, pausing from all the other stuff to really hone in on a young person. Look at all that you came up with. Imagine being in a room or with your team and really going in deep on those kinds of questions before you do anything else. Really getting into the head and the psyche, given that we all come with our particular experiences and biases, but being in that room with multiple individuals going through that process of really, really, really trying to think about the end user, if you will, of whatever program or service that you come up with, think about how much richer our interventions and our programs could be. And so this is a tool, like I said, that I just use all the time now. I don't want to start anything without this tool. All right, I'm looking at the time keys. Let's keep going.
Neither do I. Neither do I. And it's so important in our work, even today. When I think about when I was first introduced to human-centered design, at that time, there wasn't a lot of research, but there was a lot of question around, how can we really center lived experiences of marginalized communities. And for a lot of the work for AFC and Pride Action Tank that me and Kim involves ourselves in around ending the epidemic in HIV, AIDS, as well as homelessness, we're thinking about these things, right? Especially how we think about how their stories are respected and celebrated, but also utilized in our frameworks when we're thinking about implementing, HIV prevention strategies. Stefan Wallace, a very good brother and friend of mine, has done quite a bit of work in the biomedical phase, and we're going to jump into that. But in thinking about where human-centered design has fallen in the work for ending the HIV epidemic, started looking towards the feds. We probably don't want to look towards them now, but so I looked towards CDC, when I was graduating, I found some research where they did an assessment in 2017 where they looked at 19 different health conditions, 2 mental health conditions, and 3 system processes that they were looking to change. And that's quite a bit. And what they did in this review and what they did in this assessment was looked at how design thinking and human-centered design help influence the development or the advancement of a health-related intervention, right? So when we think about CDC and those who work in the health field, we have these homegrown or regulated interventions that are designed to meet the needs or to move along a behavior change. A lot of the work that I'm doing now with AIDS United is looking at how can human-centered design influence behavior change, but much to the review of the CDC, started doing a lot of critical work with HRSA. So HRSA is the health, and I want to make sure I get this right. HRSA is the Health Resources and Services Administration, which is the agency of the U.S. Government of Health and Human Relations, and also a mouthful. However, they do quite a bit of work, and I'm really glad to do quite a bit of work around, how can we utilize human-centered design to advance the development of interventions that center youth living with HIV and other marginalized communities. Talking about health, I also have health announcements to remind you to drink water as well, that you're probably hearing Alexa, design and technology. But what we're looking at here is that we really focused in on a research project that looked at several different cities for needs for improvement around their health processes in federally qualified health centers, but really centering on how can we incorporate feedback interviews, but meaningful feedback of those that we serve in the development and quality improvement process. We looked at 16 different sites, and where it ended is that we were able to develop a toolkit that provided federally qualified health centers resources as well as frameworks that was inclusive of human-centered design as a toolkit to improve their interventions, but to also improve their processes. So, when we think about where human-centered design is evolving, right? It's evolving in healthcare in many different ways. And I'm excited about the work that we're doing with Pride Action Tank, or through Pride Action Tank and through organizations like HRSA, and then also organizations that Center for Quality Improvement, to look at it from a HIV lens. And then once again, justifying it. Some of the research shared that, you know, in these healthcare centers, we often see that our patients or our providers or even our stakeholders are not considered a part of or included as a part of that process. So in moving a lot of this work forward, what the research showed us is that, you know, human-centered design can really help us like take in consideration these human needs, but also take in consideration these things as we pair them alongside the things that make this solution viable and feasible for our organizations. This is where we move right into ideation. Kim, you want me to keep going or? Yeah? Kim's on mute. Yes, yes, no?
I know, I started talking in
Go right ahead.
2020. So the youth summit that we talked about a bit ago was actually the second time that we used some of the tools in human-centered design and design thinking, and we're kind of going back and forth on those terms. Design thinking is sort of under human-centered design. Is that right, Keith? Yeah.
Yeah, it's like the design, when you think of all of it, it's all, you know, under that 3 pillars, but in design thinking, it's actually like the practice, and it's the most common, but even when you strip it away, it's design. We're designing.
That's right. So we also use this framework in one of our annual ideation retreats with our advisory council. So Pride Action Tank has a 30-member advisory council every February. We ideate both to talk about our model, but also to talk about the activities that we're going to work on in the next year. And we've used retreats in different ways over the years. Sometimes they've helped shape the role of the advisory council or drilled down deeper into various areas. And a couple of years ago, we used the design thinking framework to do some strategic planning. And we'll talk about a little bit of that next. So ideation is a big part of what we do. You know, here are some examples of ideation for young people, building the capacity of families to support youth, and the actual youth summit focused on providing solutions to these. So to that, that objective around building family capacity, they wanted to provide a multimedia training for families to really help them understand what it is to be an LGBTQ young person, but also navigating these systems. Creating safe school environments. They wanted to enact cultural competency training, especially in schools with no tolerance policies, because LGBTQ youth tend to be overly represented among those who are the subjects of the no tolerance policies. Coordinating support for youth across systems. What we learned during our summit, and we kind of knew going in, and this will probably come to no surprises, is to any of you, there aren't many formal platforms for staff and leadership and decision makers across systems to talk to each other. Juvenile justice, in schools, and child welfare, just not many formal platforms. And so that's something that we want to continue to work on. In addition to coordinating actual support and services, young people talked about a Navigator app, and we know that there's something similar that Chicago Coalition for the Homeless has developed that we want to talk about building out to include other systems. And then support for youth who are aging out of systems is just a huge, huge gap. And so we're looking at creative housing solutions with the workforce pipeline built in. And one of the projects that actually spun out of Pride Action Tank and is a separate 501c3 is One Roof Chicago, which is looking at multi-generational housing with a workforce development pipeline included for young people who, and I'll say older adults too, who want to work in the aging sector and to create a career path for them. Next slide, please.
I think y'all can tell how excited I am about the work of Action Tank. I just, I'm like, what they doing? Yes, product.
I know. We have so much going on. Sometimes I forget to even talk about it. So I mentioned that we used human-centered design framework before with our advisory council. And one of the tools that we used was a service model blueprint. And we'll just walk through this slide very briefly because we should get to other things. Keys, you want to jump in here just to talk generally about what this is?
Yeah, absolutely. So as you see, much of human-centered design is about bringing things together, right? What are things that they desire, that they need? What are things that we can do, you know, as an organization? What do we need to do those things? But then also, you know, what problems is it solving? Is this something sustainable that we can do? So I'm looking at, and many people, those who are familiar with the framework have probably heard about the business model canvas, but as said, with the empathy map, you want to you want to redo these, or you can redo these tools as an opportunity to center things that you need, right? Focus on what you need and what they need, what they want, what you can do. So thinking about this, I'm really in facilitating this as an activity, you know, visual techniques like this really gives life to what we're doing, but it also aligns a way that, you know, we can come together and capture that big picture without going through all the nitties and gritties, but visualizing it. The tool really served as an opportunity for us to connect the different insights, but then also to think about the value that we offered in the solution and what we needed to do our best work. So what are the communities that we are serving? What are our service offerings, right? What problem are we serving? What value are we presenting? What channels are we engaging them in? What are we communicating to them through? Where are they present, especially amid COVID? What type of relationship do we want to build with them, right? What type of barriers are they experiencing in the actual action or the outcome that we're looking to bring about, or the behavior change? What type of partnerships? Partnerships are so important. Kim says this line, and it's my favorite one. I'm also a Kim fan. Community work is never a solo act, and that even this is a partnership, and the partnership that you have with the youth in facilitating this process is a relationship. So when you're building this out, if you don't have a partnership with the people that you're looking to serve or that you're looking to present value to, then that's the iteration right there. You might want to loop back and do some work. All right. So I'm going to move forward. So, you know, what we're looking at really in the next couple of slides is some of the insights that came out of both the summit that we had, but our discussions with our advisory council, right? I'll let Kim add, but, you know, wanted to really show you where it can go, where it can lead. It's about gathering those ideas, and some of those ideas won't work, right? But you want to at least consider them and put them into the framework of like, how would this work? Is this feasible? Is it viable? So
yeah,
this,
absolutely right. And so those are the things that we sort of walk through in thinking about, you know, even putting together this youth summit, you know, what was sort of already at the table and what did we need to shore up? Who are we trying to serve? You know, who are we working with in service of to get this work done? What are the critical relationships we either already have, or to Key's point, where there's a gap, where do we need to fill that gap? In thinking about the problem really as a whole around systems involved youth, bringing in some of that gap knowledge too. And then, you know, what are our various teams and resources that we already have at hand? We worked with a group of young people to design that summit. We also had our advisory board engaged, and other partners and friends of Pride Action Take funders and in-kind donors were critical to making this happen. We have, I like to say, sort of a, what is that called? Fiscal sponsorship on steroids with AIDS Foundation Chicago. We're just a part of AFC at this point. We started out being sort of a separate entity under AFC, but we're married now and we're not getting divorced. So we do this work together. Broadway Youth Center was also a big, big partner with this youth summit. And when it came to what the value is, a lot of times I don't think our organizations think about what value we're bringing to the space. Sometimes I think it's because we're afraid of the answer, but especially when you really dig deep on some of the work that we sometimes get stuck doing over and over again. But there's such value in this case to creating platforms for young people's voices that we really always want to be super intentional about how we do that. So we had all kinds of supports in place to make that happen and to have them be present and fully engaged. Keys, I'll turn it back over to you.
Okay, because I'm also looking at the time.
Got about a little less than 10 minutes, so we can skip some slides or we can.
So in thinking about implementation, just to cover the last phase and what Kim was talking about is that now that we have the insights, now that we have ideas to implement, to try and to test, really focusing on like how quickly can we get something out and start getting feedback, right? So so many times we're trying to make it perfect, and like our phones, we get these updates, even today, iterations of decks and such. It isn't about it being perfect, right? Because they can tell you if it's not perfect. Allow them to tell you it is not perfect, right? But share your ideas. Try not to defend them, but then also listen to what others have to say, your colleagues, your stakeholders, but most importantly, who you're serving. And this is where we see the actual implementation of that solution, right? And see both their insights and both the work of the advisory board and Kim and Pat reflected. Kim, do you want to say anything about this one?
So I mentioned before that we usually have 2-day summits and they're usually 2 consecutive days, but this time because we were so centered on young people, we wanted to provide space between the 2 days so that the young people summit in convening think tank, we'll say, could influence the second day. So what you're seeing here is pictures of the second day that had the service providers, the funders, the elected and appointed officials, other folks interested in this topic who aren't necessarily living it. And they came together both to hear from young people, to hear about the challenges, the barriers that they're experiencing, and they also got a chance to ideate. And what we have done since then, and what we always do, is we bring the ideation from the impacted population day and the ideation from the service provider, et cetera, day together to come up with themes and projects that we continue to work on. And just to quickly go through some of the things that we are working on, next week we have a virtual summit with youth in DCF care across the state to create an LGBTQ youth Bill of Rights. We're doing this virtually, right? So we're bringing some of these tools into that project. We're working with Illinois Safe Schools Alliance to create a series of programs to benefit young people during this virtual time. And the first one will be a panel and discussion on queering virtual spaces to engage young people. And then a project that's larger and ongoing and isn't quite shaped yet is to really figure out this child welfare to juvenile justice pipeline that we see. There's a lot of overlap between these two populations and LGBTQ youth are way overrepresented in that overlap. So trying to bring some equity and some justice into those systems and rebuilding, which is a longer term project. But those are some of the things that came out of all the things that we were hearing. And I mentioned that housing project too, that includes the workforce development component. So I just wanted to quickly jump there. Should we not do this?
Yeah, let's not. We can move right in. So this is another tool that we use around growth, and this is where we really see the innovation. So we can share this out definitely with the tools. It's called Ways to Grow. Another way to think about it. But as we're wrapping up for like the sake of time, really, and I think that you guys probably got like a pretty clear idea of it. It's really focusing on the people that lead. Focusing on the people and the communities that lead to better services, interventions, and actual people experiences. It's not good to assume, but immersing them and immersing yourself in the process really, presents an opportunity to get some deeper insights that's not possible in traditional methods, So through iterations and adoption of the tools towards your needs, you guys are definitely on the road to success. Kim?
Yeah, so I'd like to say, some of you may have some questions. If you can pop them in the chat, we may not get to all of them, but we can certainly answer questions offline too. Here are some tools that you could use that go into more depth into some of the information that we've shared, including some books, but there's actually some online tools that you can start using right now. More cool stuff below. I love that. So if folks just want to, sort of type in some reflections in the chat just to share what you're feeling and give us a sense of where we might need to be prepared to answer some questions or whatever, that would be great.
And something to keep note, like normally this, what we try to do is like take you through all 3 sections, and in 60 minutes compared to 6 hours to even 3 hours is a lot to cover. And there's always something, there's always more, I like to say, to discover and more to, think about. But when I learned this in the 6-hour framework, and then implement it in a 6 month apprenticeship in Finland with the Aalto Design Factory, with a focus on product innovation. So there's different ways. As a presentation, we try to make it as engaging, but it's a lot, but it's a lot of learning, and I love learning.
And I put my email address in the chat. Yeah. And I know we're going to share the slides too. I just don't know when you'll get them.
Yeah, we will. And Kim and Dantes, if you want to email me a PDF of your slides. If folks would like the slides right away, you might want to email Kim directly, if that's okay with you, Kim. Sure. Just because there's a lot of presentations we're going to try to upload in the next few weeks, in the next couple of weeks. But this was really refreshing, because particularly in a time when we're reacting, we're just constantly reacting to what's happening and just trying to recover. This is such a forward-thinking model and presentation, and it just gave me a lot to think about. The cow activity was like, why didn't I think of ice cream? I love ice cream. It's just really, it does make me think about how we need to take some time to come out of our box and come out of whatever we're embedded in, our work environment or whatever, and think more creatively. And this is such an amazing process to help us do that. So I'm so thrilled to be part of this and to hear you talk, Kim and Dantes. This was so much fun. It was so much fun to see the cows. It was great to see all of you. I'm going to stop recording now, and hopefully we'll share this